Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 63. Acne in patients with liver disease and metabolic disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. The insulin resistance driving metabolic syndrome increases androgens and sebum production, worsening acne. Managing metabolic syndrome through weight loss, exercise, and dietary changes often improves acne. PCOS involves insulin resistance and is therefore associated with metabolic syndrome and worse acne. Managing PCOS-related acne involves addressing insulin resistance through diet, exercise, and potentially medications like metformin. Diabetes, particularly poorly controlled diabetes, worsens acne through multiple mechanisms: inflammation, immune dysfunction, altered wound healing. Optimizing diabetes control improves acne. Liver metabolizing medications used for acne, like spironolactone, oral antibiotics, require dose adjustment in liver disease and monitoring for side effects. Patients with liver disease should have liver-specific dosing guidance from their healthcare providers. Hepatotoxic medications, like isotretinoin, which requires liver monitoring even in healthy individuals, should be used cautiously or avoided in patients with liver disease. Baseline liver function testing and monitoring are essential if used. Weight loss, if overweight, provides multiple benefits including acne improvement through metabolic and hormonal mechanisms. Lifestyle interventions addressing metabolic health support both acne management and overall health. Guide 64. Acne in patients with polycystic ovary syndrome, PCOS, comprehensive management. PCOS is a common hormonal disorder strongly associated with acne. Understanding PCOS-specific acne management optimizes outcomes for affected individuals. PCOS involves androgen excess, ovulatory dysfunction, and typically insulin resistance. These factors combine to cause often severe acne, frequently concentrated on the lower face and jawline. Hormonal testing for PCOS includes elevated androgens, elevated LH with normal or low FSH, and often elevated fasting insulin and insulin resistance markers. Pelvic ultrasound might show polycystic appearing ovaries. Acne in PCOS often differs from typical hormonal acne in severity and resistance to standard treatments. Many PCOS patients with acne require systemic hormonal treatment for adequate control. Birth control pills are first-line hormonal treatment for PCOS acne, with formulations containing low androgenic progestins preferred. Typical acne improvement occurs within 3 to 6 months. Spironolactone provides additional androgen reduction when combined with hormonal contraceptives. The combination often provides better acne control than either alone. Metformin, while primarily treating insulin resistance, can modestly improve acne by improving metabolic parameters and potentially reducing androgens. Typical dosing is 1,000 to 2,000 mg daily. Lifestyle interventions are particularly important in PCOS. Weight loss, even if overweight, or weight management if normal weight, improves insulin sensitivity and androgen levels, often improving acne significantly. Exercise, particularly resistance training, improves insulin sensitivity. Dietary modifications emphasizing low glycemic foods support metabolic health. Comprehensive PCOS acne management combines hormonal contraceptives, spironolactone if needed, metformin if insulin resistant, lifestyle optimization, topical acne treatments, and potentially professional treatments. This multifaceted approach addresses both the underlying PCOS pathophysiology and surface acne manifestations. Many women with PCOS achieve significant acne improvement through this comprehensive approach even if acne was previously treatment-resistant. The key is addressing underlying PCOS rather than only treating surface acne. Guide 65, Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, insulin surges, triggering increased sebaceous gland activity and androgen production, both of which worsen acne. Foods with high glycemic index include white bread, white rice, sugary beverages, refined cereals, and most processed snacks. Replace these with low glycemic alternatives: whole grain bread, brown rice, vegetables, legumes, and nuts. This dietary shift reduces blood sugar volatility and decreases acne-triggering hormonal responses. Dairy products, particularly milk, contain hormones and bioactive peptides that may trigger acne in susceptible individuals. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin, and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. Regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15: Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery. Single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle: 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional: monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the iPledge program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. Salicylic acid formulations meant to be applied to specific areas or the entire face, typically 2 to 3 times weekly. They're left on the skin and provide significant exfoliation. These are powerful products best used by those with resilient, acne-prone skin who have already adapted to gentler salicylic acid products. Spot treatments apply high concentrations of salicylic acid directly to individual breakouts for targeted treatment. These are excellent for treating isolated pimples without exfoliating your entire face. Starting with salicylic acid requires a conservative approach. If you've never used it before, begin with a 0.5% cleanser or 1% toner used 2 to 3 times weekly. Use it for 2 to 3 weeks, assessing your skin's response. If your skin tolerates it well without excessive irritation, dryness, or sensitivity, you can increase frequency to daily use or switch to a higher concentration product. When applying salicylic acid toners or serums, use clean fingertips or a cotton pad to apply evenly across your face, focusing on areas prone to acne. Use about a nickel-sized amount for your entire face. Apply to completely dry skin. Applying to damp skin increases irritation. Allow the product to dry completely before applying other products. Some salicylic acid products are meant to stay on your skin indefinitely, while others are meant to be rinsed off after a specific time. Read instructions carefully. Common mistakes when using salicylic acid include starting with too high a concentration, using it too frequently, combining it with too many other actives, and failing to moisturize adequately afterward. Starting with 2% and using it daily will almost certainly cause excessive irritation, dryness, and peeling. You're much better served starting gently and gradually increasing. Never combine salicylic acid with benzoyl peroxide on the same evening initially. Both are exfoliating actives that can cause significant irritation if used together by someone whose skin isn't accustomed to strong treatments. Once your skin has adapted to each individually, you might combine them cautiously, but build up to this gradually. Salicylic acid makes your skin more sun-sensitive, not severely, but notably. Always use SPF 30+ sunscreen daily when using salicylic acid. This is not optional. Sun exposure can cause post-inflammatory hyperpigmentation in acne-prone skin, and salicylic acid increases this risk. Side effects of salicylic acid are generally mild and resolve with time or reduced usage. Dryness is common, particularly if you're using higher concentrations or frequent applications. Combat dryness by using a good hydrating moisturizer immediately after applying salicylic acid. Mild peeling is normal and actually desirable. It indicates exfoliation is occurring. However, severe peeling suggests you're using too much. Slight irritation and redness may occur initially but typically resolve within 1 to 2 weeks. Some people experience temporary worsening of acne as impurities are brought to the surface, but this purging phase is usually short-lived. Results from salicylic acid appear gradually. After 2 weeks of consistent use, you might notice smoother texture. After 4 weeks, you should see reduced comedones and fewer new breakouts. Most people see significant improvement after 6 to 8 weeks of consistent use. However, salicylic acid works best for comedonal acne, blackheads and whiteheads, and mild inflammatory acne. For severe inflammatory or cystic acne, combining salicylic acid with other treatments like benzoyl peroxide or prescription retinoids is often necessary. Salicylic acid is safe for long-term use. Many people successfully maintain clear skin using salicylic acid indefinitely as their primary exfoliation and treatment method. However, occasionally, skin can become desensitized to salicylic acid if used continuously for extended periods. If you notice that salicylic acid that previously worked well seems less effective, take a 1 to 2 week break, then resume using it. This often restores its effectiveness. Alternatively, you can rotate between salicylic acid and other exfoliants like glycolic acid to prevent desensitization. Guide 5. Benzoyl peroxide, Comprehensive Guide to Bacterial Killing and Inflammatory Acne Treatment. Benzoyl peroxide is one of the most effective and widely recommended acne treatments by dermatologists. Unlike salicylic acid, which primarily removes dead skin cells and excess oil, benzoyl peroxide specifically targets the acne-causing bacterium Cutibacterium acnes. Understanding benzoyl peroxide's mechanism, concentrations, and proper application is crucial for maximizing its effectiveness while minimizing side effects. Benzoyl peroxide works through a unique mechanism. It generates reactive oxygen species that directly kill bacteria. This is fundamentally different from antibiotics, which the bacteria can develop resistance to. Bacteria cannot develop resistance to benzoyl peroxide because it works through oxidative stress rather than targeting specific bacterial proteins. This makes benzoyl peroxide an invaluable tool in acne treatment, particularly since antibiotic resistance is an increasingly serious problem in dermatology. Beyond bacterial killing, benzoyl peroxide has anti-inflammatory effects, helping reduce the redness and swelling associated with inflammatory acne. It also has mild sebum-reducing properties and may help with some degree of come-down reduction, though it's less effective for this than salicylic acid. Benzoyl peroxide comes in concentrations ranging from 2.5% to 10%, with some over-the-counter products going up to 10% and prescription-strength versions available at higher concentrations. Interestingly, studies show that 2.5% benzoyl peroxide is roughly equivalent in effectiveness to 10% benzoyl peroxide. The higher concentration doesn't necessarily mean better results, it primarily means more potential for irritation. Therefore, it's prudent to start with 2.5% and only increase concentration if needed. Benzoyl peroxide comes in multiple product formats. Cleansers containing 2.5 to 5% benzoyl peroxide gently incorporate this ingredient into your daily cleansing routine. These are appropriate for maintenance or mild acne. Spot treatments allow you to apply high concentrations directly to individual pimples. Serums or leave-on treatments apply benzoyl peroxide across your entire face and are left on the skin. These can be used daily or as directed. Gels and creams are thicker formulations that may have different absorption characteristics depending on your skin type. Starting with benzoyl peroxide requires similar caution as salicylic acid. If you're new to benzoyl peroxide, begin with a 2.5% product, ideally in a cleanser format or spot treatment, used once daily. Most people find evening application easier than morning application since benzoyl peroxide doesn't require sun protection and can be easily washed off in the morning. After 1 to 2 weeks, assess your skin's tolerance. If you're experiencing mild irritation or dryness but your acne is improving, continue. After 2 to 3 weeks, if your skin tolerates the product well, you can increase frequency to twice daily or increase the concentration to 5%. Application technique is critical. Apply benzoyl peroxide to completely clean, completely dry skin. This is more important with benzoyl peroxide than with most other products. If your skin is even slightly damp, benzoyl peroxide will irritate more readily. Allow your cleanser to fully absorb and dry, then apply benzoyl peroxide. Use a small amount, about the size of a pea for your entire face if using a leave-on product, or a slightly larger amount for spot treatment. Apply gently, allowing the product to absorb fully before applying other products. Benzoyl peroxide has a particular drawback: it bleaches fabrics and hair. If you apply it to your face, it can bleach your pillowcase, bedding, towels, and hair. Many people apply benzoyl peroxide in the evening and wash it off in the morning with their cleanser to avoid this issue. If you apply it in the morning, be extremely careful not to get it on your hair, eyebrows, or any colored clothing. Some people apply it as a spot treatment right before bed, allowing it to work overnight before being washed off in the morning. If bleaching is a concern, you might prefer using benzoyl peroxide in a wash-off cleanser format where the contact time is brief. Side effects of benzoyl peroxide are generally more significant than salicylic acid. Dryness is very common, particularly with higher concentrations or frequent applications. Combat this by using an excellent moisturizer after applying benzoyl peroxide. Some people find that benzoyl peroxide dries their skin excessively even at 2.5% concentration. If this is you, try reducing frequency to every other day or using it only as a spot treatment. Irritation and redness are common, particularly when starting benzoyl peroxide or when increasing concentration. This irritation is usually temporary and subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, dermatitis, or reactions, discontinue use and consult a dermatologist. Contact dermatitis to benzoyl peroxide, while rare, does occur. If you develop an itchy rash that doesn't improve with reduced frequency, you may be allergic. Discontinue use and inform your dermatologist. Many people experience acne purging when starting benzoyl peroxide, temporary worsening of acne as bacteria die off and impurities are brought to the surface. This purging typically lasts 1 to 2 weeks. If purging lasts longer, consult your dermatologist. Photosensitivity is not a significant issue with benzoyl peroxide like it is with some other acne treatments, but you should still use sunscreen daily for general skin protection. Benzoyl peroxide is particularly effective for inflammatory papules and pustules, the classic red pimples with white centers. It's less effective for comedonal acne, blackheads and whiteheads, where salicylic acid is superior. Many dermatologists recommend combining benzoyl peroxide with salicylic acid for comprehensive acne treatment. Use salicylic acid to address comedones and exfoliate, and benzoyl peroxide to kill bacteria and reduce inflammation. Results from benzoyl peroxide appear relatively quickly. Supplementation is safe for most people, though it can cause mild gastrointestinal upset and rare interactions with blood thinners. Plant-based omega-3, ALA from flax or chia, is less effective than fish-derived EPA/DHA. Probiotics as oral supplements have mixed evidence for acne. While probiotics support gut health and might support skin through gut-skin axis mechanisms, specific acne benefits aren't reliably demonstrated. Some people report acne improvement with specific probiotic strains, but individual variation is substantial. If interested in probiotics, quality products with documented effective strains are preferable to low-quality products, though quality doesn't guarantee benefit. N-acetylcysteine supports glutathione production and has anti-inflammatory and antioxidant effects. Some evidence suggests NAC might improve inflammatory acne. Typical dosing is 600 to 1,200 mg daily. NAC is generally well tolerated, though some people experience gastrointestinal upset. Spironolactone supplementation is sometimes discussed, but spironolactone is a pharmaceutical medication, not a supplement, requiring prescription. This isn't applicable for over-the-counter supplementation. Saw palmetto is a botanical supplement claimed to reduce DHT and support acne. Evidence is limited and mostly from prostate health studies rather than acne-specific research. Acne-specific benefits aren't well established. Red clover contains isoflavones with weak estrogenic effects, claimed to reduce androgen activity and improve acne. However, evidence is limited. Additionally, red clover might interact with hormonal medications. Spearmint tea supplementation has some evidence for hormonal acne reduction through weak antiandrogenic effects. Drinking 2 cups of spearmint tea daily for several months might improve hormonal acne modestly in some women. This is one of the few plant-based approaches with dedicated acne research, though evidence is still limited. Licorice extract is promoted for anti-inflammatory effects. Topical licorice has some evidence for skin benefit, though oral licorice supplementation for acne lacks strong evidence. Additionally, chronic licorice consumption can affect electrolytes and blood pressure. Selenium supplementation at moderate levels, 55 to 200 micrograms daily, might support skin health through antioxidant mechanisms. However, acne-specific benefits aren't well established, and excessive selenium causes toxicity. Important considerations for supplementation: supplements aren't regulated as rigorously as pharmaceuticals, meaning quality, purity, and actual content vary between brands. Third-party testing helps identify higher quality products. Supplements can interact with medications. Discuss supplementation with your healthcare provider, particularly if taking medications. Supplements take weeks to months to demonstrate benefits. Expecting rapid results leads to disappointment. Supplements work best supporting other treatments, not replacing proven acne treatments. Many people take ineffective supplements indefinitely while their acne worsens, when proven topical treatments would help. Finally, the supplement industry profits from marketing claims exceeding evidence. Skepticism is appropriate. Practical approach: implement proven lifestyle modifications, sleep, stress management, diet, and proven topical treatments first. If acne improvement plateaus, consider evidence-based supplementation like zinc, vitamin D, or omega-3s. Avoid high-dose, poorly studied supplements marketed with exaggerated claims. Guide 39: Acne in diverse skin types and ethnic considerations. Acne manifestation, treatment response, and complications vary across different skin types and ethnic backgrounds. Understanding these differences ensures appropriate, culturally informed acne management. Skin type classification using Fitzpatrick scale ranges from type 1, very fair, burns easily, to type 6, very dark, never burns. Acne occurs across all skin types, but manifestation and complication risks differ significantly. Post-inflammatory hyperpigmentation, PIH, is more prominent and persistent in darker skin types, types 4 to 6. While lighter skin types experience PIH that fades within 3 to 6 months, darker skin types often experience PIH persisting 6 to 12 months or longer. This makes PIH management particularly important for darker skin types. Aggressive sun protection, early treatment of active acne to minimize inflammation, and specific PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly important for darker skin. Post-inflammatory erythema, redness persisting after acne heals, is more prominent in lighter skin types, while PIH dominates in darker skin types. Understanding your skin type predisposes you to which complication helps target appropriate treatments. Acne scarring appears across all skin types, though manifestation differs. Hypertrophic scars, raised, thick scars, are more common in darker skin types, while atrophic scars, depressed scars, are more common in lighter skin types. Some darker skin types experience keloid scars, excessive scarring extending beyond original injury, requiring specific treatment approaches. Treatment tolerability varies by skin type. Benzoyl peroxide can appear white or chalky on very dark skin, making application inconvenient. Using micronized formulations or applying to clean, dry skin before any other products helps. Some people with darker skin prefer avoiding benzoyl peroxide entirely and using alternatives like salicylic acid or retinoids. Photosensitivity from retinoids and chemical exfoliants presents differently across skin types. While all skin types experience increased sun sensitivity, darker skin types experience more severe hyperpigmentation from sun exposure, making sun protection even more critical. Lighter skin types experience more severe sunburn from photosensitivity. Chemical peels require different approach across skin types. Superficial peels are generally safe for all skin types. However, medium depth and particularly deep peels carry higher complication risk in darker skin types, including post-inflammatory hyperpigmentation and abnormal pigmentation. Dermatologists experienced in treating darker skin types are preferable for deeper peels. Here in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and anti-inflammatory properties, reduces sebum production, minimizes pore size, and strengthens the skin barrier. At 4 to 5% concentration in serums or moisturizers, used daily, niacinamide provides noticeable benefits. It's also gentle enough to use with other actives without concern. Alpha-lipoic acid is a powerful antioxidant that penetrates both water and lipid layers of skin. It reduces inflammation, supports barrier function, and has some evidence for acne reduction through anti-inflammatory mechanisms. Alpha-lipoic acid is typically used in serums at 5% concentration, applied daily. It's generally well tolerated but can cause mild irritation in very sensitive skin. Ferulic acid is a plant-derived antioxidant that works synergistically with vitamins C and E for enhanced antioxidant protection. Ferulic acid also has direct anti-inflammatory effects. It's commonly found in advanced serums and provides additional antioxidant support beyond vitamin C alone. Resveratrol is a potent antioxidant from plants like grapes. It reduces inflammation and has some antimicrobial properties. While not a primary acne treatment, it provides useful antioxidant support. Resveratrol is often combined with other antioxidants in advanced serums. Bakuchiol is a natural retinol alternative derived from the babachi plant. It provides retinol-like benefits including increased cell turnover, collagen stimulation, and anti-aging effects without being a true retinoid. Importantly, bakuchiol doesn't cause photosensitivity or irritation like retinoids, making it suitable for very sensitive skin or as an alternative for those who can't tolerate retinoids. For acne specifically, bakuchiol is less powerful than tretinoin or retinol, but provides useful cellular turnover support. Salicylic acid analogues include beta-hydroxy acids beyond standard salicylic acid. LHF, lipohydroxy acid, is similar to salicylic acid but slightly milder, making it suitable for sensitive skin. These salicylic acid analogues provide exfoliating benefits with potentially less irritation than standard salicylic acid. Azelaic acid, beyond its use for hyperpigmentation, has direct acne-fighting properties. At 10 to 15% concentration, azelaic acid has antibacterial, anti-inflammatory, and anti-keratinizing effects. It's a versatile ingredient useful for acne, rosacea, and post-inflammatory hyperpigmentation simultaneously. Botanical extracts like tea tree oil, witch hazel, and green tea have mild antibacterial and anti-inflammatory properties. While weaker than pharmaceutical actives, they provide supportive benefits. Many skincare products combine multiple botanical extracts for cumulative benefit. These are generally well tolerated, making them suitable for sensitive skin seeking some acne support without strong pharmaceutical actives. Retinaldehyde, also called retinol, is a retinoid intermediate between retinol and retinoic acid. It's slightly stronger than retinol but weaker and less irritating than tretinoin. For those finding tretinoin too strong or seeking stronger benefits than retinol provides, retinaldehyde is an excellent middle ground. It's increasingly available in advanced skincare products. Encapsulation technology makes some ingredients more stable or less irritating. Encapsulated retinol, for example, releases gradually over time, reducing irritation while maintaining effectiveness. Similarly, encapsulated vitamin C remains stable longer and is less irritating than non-encapsulated forms. Time-release technology delivers ingredients gradually rather than all at once. This reduces initial irritation while providing extended benefits. Some treatments use time release to deliver benzoyl peroxide or salicylic acid gradually throughout the day. Polyhydroxy acids, PHAs, like gluconolactone and galactose are gentler exfoliants than AHAs and BHAs. PHAs have larger molecular structures that penetrate more slowly, making them suitable for sensitive skin or those who can't tolerate standard exfoliants. They provide exfoliating benefits with less irritation. Using cosmeceuticals strategically enhances your acne regimen. For example, you might use salicylic acid for exfoliation, benzoyl peroxide for bacterial control, then add niacinamide serum for sebum control and barrier support, followed by a hyaluronic acid serum for hydration and a moisturizer with peptides for skin support. This multi-ingredient approach addresses multiple aspects of skin health. However, avoid the trap of skincare complexity. More products don't automatically mean better results. Focus on core treatments: cleanse, treat with proven actives, moisturize, protect, then add supportive ingredients. A simple routine with proven actives beats a complex routine with unproven ingredients. Guide 28, Acne and Mental Health, Psychological Impact and Management Strategies. Acne's psychological and emotional effects are profound and often underestimated. Understanding acne's mental health impact and implementing strategies to manage the psychological component is essential for overall well-being during acne treatment. The psychological burden of acne is real and significant. Studies consistently demonstrate that acne causes depression, anxiety, reduced self-esteem, and social withdrawal in many sufferers. This burden is disproportionate to acne's physical severity, Even mild acne can cause substantial psychological distress, while severe acne might cause less psychological impact in individuals with resilient self-image. Visible acne, particularly on the face, affects how others perceive you and how you believe others perceive you. This perception, whether accurate or not, influences social interactions and self-confidence. Many acne sufferers report avoiding social situations, dating, or professional opportunities due to acne-related anxiety. Some experience body image disturbance and depression stemming from acne. The unpredictability of acne exacerbates psychological distress. Not knowing when breakouts will occur, having acne that doesn't respond to treatment despite best efforts, and experiencing setbacks after progress all contribute to frustration, helplessness, and depression. The search for the right treatment becomes emotionally exhausting. Acne's psychological impact justifies aggressive medical treatment even for acne that isn't technically severe by dermatological standards. If acne causes significant psychological distress, depression, or anxiety affecting quality of life, treatment should be pursued regardless of how many lesions you have. Your mental health is legitimate reason for professional acne treatment. Several psychological strategies help manage acne-related distress. Cognitive reframing involves recognizing and challenging negative thoughts about acne. Rather than, "Everyone will think I'm disgusting because of my acne," reframe to, "Most people don't notice my acne as much." Individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for transfeminine individuals, typically improves acne over time as androgens are suppressed. Many transfeminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in transfeminine individuals. Timeline for hormone therapy. Acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56. Occupational acne syndromes, tar acne, oil acne, and chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Guide 63. Acne in patients with liver disease and metabolic disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. Stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98. Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99. Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N-of-1 One testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N-of-1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatment's insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68, Acne in Older Adults, Age-Related Changes and Treatment Adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is action can also cause microtears in your skin barrier, leading to increased sensitivity and irritation. For these reasons, dermatologists typically recommend avoiding physical scrubs if you have acne. Chemical exfoliation is gentler and more effective. There are two main types of chemical exfoliants, alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs. AHAs, including glycolic acid and lactic acid, are water-soluble and work on the skin's surface. They're excellent for general exfoliation, improving texture, and reducing the appearance of fine lines. However, they don't penetrate into oil-filled pores effectively. BHAs, particularly salicylic acid, are oil-soluble and can penetrate into sebum-filled pores, making them ideal for acne-prone skin. Salicylic acid dissolves the sebum and dead skin cell plug within the follicle, directly preventing and treating comedones. For acne-prone skin, exfoliating 2 to 3 times weekly with salicylic acid is generally appropriate. Some people with very resilient skin can tolerate daily use, while those with sensitive skin may do better with once or twice weekly exfoliation. Begin conservatively with 2 to 3 times weekly, observing how your skin responds over 2 to 3 weeks before increasing frequency. Exfoliation products come in various formats. Exfoliating cleansers contain salicylic acid and are used during your regular cleansing routine. These are gentle and convenient for daily use. Exfoliating toners are applied after cleansing and before other treatments. They're typically stronger than cleansers and are meant to be left on the skin. Exfoliating serums and treatments are the most concentrated forms and are usually applied 2 to 3 times weekly. Exfoliating masks are meant to be applied for a specific duration, usually 10 to 15 minutes, then rinsed off. When starting exfoliation, begin with a lower concentration of salicylic acid, typically 0.5% to 1%, and gradually work up to 2% as your skin builds tolerance. Many beginners make the mistake of jumping to high concentrations, causing excessive irritation, dryness, and peeling. This leads them to conclude that exfoliation doesn't work for them when the actual problem was starting too strong. The exfoliation process requires proper technique. Apply your exfoliating product to clean, completely dry skin. Applying to damp skin increases irritation and reduces effectiveness. Use your fingertips to apply the product gently, spreading it evenly across your face, paying special attention to areas where acne is most prevalent. Some exfoliating products are meant to be left on overnight, while others are rinsed off after a specific duration. Follow product instructions carefully. During the initial exfoliation period, expect some adjustment. Your skin may experience mild redness, slight dryness, or mild peeling, This is normal and typically subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, excessive peeling, or significant discomfort, reduce your exfoliation frequency or concentration. Listen to your skin, it will tell you what it needs. Never combine multiple exfoliating products on the same day, and especially avoid combining exfoliants with other strong actives like retinoids or benzoyl peroxide on the same night initially. This overexfoliation damages your skin barrier, causes excessive irritation, and can actually worsen acne. Once your skin is accustomed to each product individually, you can sometimes combine them, but do so cautiously and only if your skin tolerates it well. Some people experience purging when they begin exfoliation, where acne temporarily worsens as the exfoliant brings impurities to the skin surface. This is generally a positive sign that the product is working, and it usually subsides within 1 to 2 weeks. However, if purging lasts longer than 2 to 3 weeks or becomes unbearable, discontinue the product and consult a dermatologist. After exfoliating, your skin barrier is compromised and needs careful management. Moisturize generously with a product suitable for your skin type. Avoid other potentially irritating ingredients like vitamin C, niacinamide in high concentrations, or peptides on exfoliation days. Stick to basic cleanse, exfoliate, and moisturize. Use sunscreen religiously, as exfoliated skin is more susceptible to UV damage. Seasonal variations affect exfoliation needs. During winter, when skin is naturally drier, you may need to reduce exfoliation frequency. During summer, when skin is oilier and more resilient, you might tolerate more frequent exfoliation. Listen to your skin and adjust accordingly. Results from regular exfoliation appear gradually. After 4 weeks of consistent exfoliation with salicylic acid, you should notice smoother texture, fewer comedones, and generally improved skin clarity. Acne lesions should appear flatter and less inflamed. However, exfoliation is most effective as part of a comprehensive acne treatment plan, not as a standalone solution. Guide 4: Salicylic Acid, the Science, Concentrations, and Complete Application Guide. Salicylic acid has been a cornerstone of acne treatment for decades, and understanding its mechanism and proper use is essential for anyone dealing with acne. Salicylic acid is a beta-hydroxy acid, BHA, meaning it's oil-soluble. This oil solubility is what makes it particularly effective for acne-prone skin. It can penetrate into oil-filled pores where other water-soluble ingredients cannot reach. Salicylic acid works through multiple mechanisms. First, it acts as a keratolytic, meaning it helps dissolve the protein bonds between dead skin cells, promoting cell shedding. Inside the follicle, it dissolves the sebum and dead skin cell mixture that forms come-done plugs. Second, it has mild antibacterial properties, helping reduce bacterial colonization within blocked pores. Third, it has anti-inflammatory effects, reducing the redness and irritation associated with acne lesions. Fourth, it can stimulate cellular turnover, promoting healthier skin overall. Salicylic acid comes in various concentrations, typically ranging from 0.5% to 2%. The concentration directly correlates with effectiveness and also with irritation potential. A 0.5% solution is very gentle, making it suitable for sensitive skin or those new to salicylic acid. A 1% solution is considered standard for most people with acne-prone skin, providing a good balance between effectiveness and tolerability. A 2% solution is the maximum recommended concentration for at-home use, offering significant exfoliating power but requiring experienced use to avoid over-irritation. Professional-grade salicylic acid can be applied at concentrations up to 20 to 30% during chemical peels, but these are only performed in clinical settings and are significantly stronger than over-the-counter products. Salicylic acid products come in numerous formats, each with advantages and disadvantages. Cleansers containing 0.5 to 2% salicylic acid are the gentlest form. You use them daily during your regular cleansing routine, and the short contact time limits irritation while still providing exfoliating benefits. Cleansers are ideal for maintaining clear skin and for beginners new to salicylic acid. Toners or liquid exfoliants contain higher concentrations and are left on the skin, providing more potent exfoliation than cleansers. These are typically applied after cleansing and before other treatments, 2 to 3 times weekly. They provide more dramatic exfoliation than cleansers but also carry more irritation risk. Serums and treatments are concentrated salicylic. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the iPledge program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. While actual isotretinoin-induced depression is rare, patients do report mood changes, and there's ongoing debate about causation versus correlation. Patients with personal or family history of depression should discuss this risk carefully with their dermatologist. Many dermatologists don't prescribe isotretinoin to patients with untreated depression or psychiatric conditions, or do so with additional psychiatric monitoring. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Consistent routines in consistent order reduce sensory overwhelm. Number 50. Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications, and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs, since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone. Laser treatments require careful consideration for darker skin types. Many traditional lasers carry higher complication risk in darker skin, including post-inflammatory hyperpigmentation and depigmentation. Lasers specifically designed for darker skin types or lower fluence approaches are preferable. This is one area where working with dermatologists experienced in treating darker skin types is particularly important. Cultural attitudes toward acne and appearance affect treatment seeking and treatment consistency. Some cultures have strong stigma around acne, while others are more accepting. Understanding your cultural context and how it affects your response to acne helps manage psychological impact. Genetic predisposition to acne varies somewhat across ethnic backgrounds. Some populations have higher acne prevalence, though individual variation is substantial and environmental factors play large roles.
第2幕、裁きの重み。店は、上品な書で、菊と書かれた控えめな木製の看板で姿を現した、菊の花。こう、広しはその入り口の前に立っていた。蜂蜜色の木で作られた引き戸からは、高級感と特別感が静かに伝わってくる。障子越しには、朝の仕込みの音がかすかに聞こえた、まな板を叩く包丁のリズム、水が流れる音、鋼同士がぶつかる金属音。彼は到着の時間を入念に測った、午前10時47分。朝食の片付けが終わり、昼の準備に取り掛かるその狭間は、厨房が人手の必要を見極める絶妙なタイミングだ。引き戸を開ける彼の手は、わずかに震えていた。いらっしゃいませ。奥から自動的に声がかかり、慌ただしい足音が続いた。真新しい着物を着た若い女性が現れ、笑顔で迎えかけたが、コウの姿を見るとその笑みが一瞬で曇った。あ、すみません、おじさん。彼女は高齢の男性に使う砕けた呼び方でそう言った。それはコウの胸に小さな刃のように突き刺さった。お昼の営業は正午からなんです。求人の件で来ました。コウは声を乱さずに答えた。厨房スタッフの募集です。彼女の目は、擦り切れたカーディガン、年齢を感じさせる手、わずかに前かがみになった背中を素早く見回した。あ、少々お待ちください。彼女は奥へ引っ込み、コウは玄関先に配達員のように取り残された。店内は本気度を物語っていた。ヒノキの一枚板でできた長いカウンターは、すべての席が寸分の狂いもなく配置されている。カウンターの奥では厨房が輝いていた。磁気ストリップに並んだドイツ製の包丁、光を反射して小さな太陽のように輝く銅鍋。しつらえは現代的でありながら伝統への敬意を忘れていない若い世代がネオ懐石と呼ぶスタイルだ。何の用だ？威厳を含んだ声が空気を切った。厨房から男が現れた。35歳くらいだろうか、白衣は刃物のようにパリッとしている。シェフボー、トックはおしゃれに傾けられ、両腕には真剣に厨房を渡り歩いてきたことを物語る火傷と傷跡が刻まれていた。これが、この店の料理長なのだろ
う。Guide 41, Microneedling RF and Advanced Microneedling Technologies for Acne Scarring. Advanced microneedling technologies combine traditional microneedling with additional energy sources or techniques for enhanced results in acne scar treatment. Understanding these advanced options helps you select appropriate professional treatments. Radiofrequency, RF, microneedling combines microneedling with radiofrequency energy delivered through the needles. As needles penetrate skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42: Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43: Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organs similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines, fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, Timing and Considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92, Acne Prevention in High-Risk Children and Adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93, Acne in Performing Arts and Image-Dependent Professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94, Acne and Sleep Disorders, Managing Acne while Managing Sleep Issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretical. Oral antibiotics don't significantly affect athletic performance at prescribed doses. Athletes can safely use oral antibiotics for acne without worrying about performance impacts. Spironolactone, if used by female athletes, is not banned in professional sports and doesn't directly affect performance, though it's a diuretic potentially affecting hydration. Athletes using spironolactone should ensure adequate electrolyte and fluid intake. Isotretinoin doesn't affect athletic performance. However, during isotretinoin treatment, skin is photosensitive and sometimes irritated, which might temporarily affect comfort during training. Otherwise, no performance impact. Retinoids don't directly affect athletic performance. Some concerns about sun-sensitizing acne treatments affecting outdoor athletes are legitimate. Sun-sensitizing treatments require extra sun protection for outdoor athletes. Using high SPF sunscreen that's sweat-resistant and reapplying frequently is necessary. Anxiety about acne potentially affecting performance is psychological rather than physiological. If acne causes confidence loss that affects athletic performance, treating acne improves performance through psychological mechanisms. Conversely, improved mental health from treating acne often improves athletic performance. The overall effect of treating acne in athletes is typically positive. Improved mental health, confidence, and well-being generally improve or maintain athletic performance. Guide 73, Acne Treatment Costs, Insurance Coverage, and Affordable Options. Cost of acne treatment varies dramatically based on treatments selected and whether insurance covers them. Understanding costs and coverage options helps make affordable choices. Over-the-counter topical treatments, salicylic acid, benzoyl peroxide, retinol, cost $5 to $30 per product and are usually affordable. These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-$100 per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-$500 per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20-$100 monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments, chemical peels $150 to $300, laser $400-$1,000+, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100-$300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable